Okay. Welcome to our webinar from the Center for Parent Information and Resources. I'm going to explain how to interact with the platform here. To use closed captioning, you need to click on CC on the caption button. Okay. We also have interpretation to Spanish. Okay. Y para eso van a ver en la banda o cinta negra un globo que indica interpretación. Hay que hacer clic allí y luego seleccionar español y oprimir donde dice Mute Original Audio. Esto último filtra completamente la presentación en inglés para que puedan escuchar claramente a Guillermo, nuestro intérprete. And for American Sign Language, we have an interpreter here, and he has been pinned, so you don't have to worry about it for your convenience. Thank you.
Good evening, everyone. My name is Carolyn Hayer. I am the director of the Center for Parent Information and Resources, and I'd like to welcome you to this evening's webinar. We are very excited that you are here to join us this evening to hear wonderful information from both the U.S. Department of Education as well as the Centers for Disease Control and Prevention. We look forward to a wonderful presentation, and I will just give you a little bit of housekeeping information. On the bottom of your screen, you will see two options. One is for the chat. The chat is where information will be broadcast to the attendees. You will not be able to type into the chat. It is for you to receive information only. You will also see at the bottom of your screen an icon for Q&A. If you would like to pose a question to the panelists during the presentation, you may type your question there. The panelists will answer as many questions as they possibly can throughout the presentation. At this time, I would like to introduce to you our panelists for this evening. First, we have Dr. Aaliyah Samuel, who is the Deputy Assistant Secretary for Local, State, and National Engagement, the Office of Communication and Outreach at the Department of Education. We also have Dr. Adam Bjork, who is the co-lead Program Integration and Equity Unit at the Vaccine Task Force at the CDC. And this evening, he will be speaking with us about Community-Based Organization Toolkit. We also have Stephanie Erstein. She is the past lead of the Stakeholder Engagement, Vaccine Task Force, and Communications at the CDC. We have Dr. Chandresh Ladva, who is the Community Guidance Lead for Community Interventions and Critical Populations Task Force at the CDC. And we have Dr. Lori Hicks. She is Captain, U.S. Public Health Service, Chief Medical Officer at the Vaccine Task Force at the CDC. I would also like to take this opportunity to thank Carmen Sanchez, our project officer at the U.S. Department of Education, for helping us to coordinate this evening's presentation. At this time, I will turn the call over to Dr. Aaliyah Samuel.
Good evening, everyone. Thank you so much for joining us. I just wanted to take a moment to share with you some of the resources that we have regarding the reopening of schools. There's been a lot of questions on the safety of schools at all grade levels, whether it's elementary, middle, high school, or post-secondary. And I wanted to share these two particular resources for a variety of reasons. One, it provides a lot of guidance, not only for parents, but educators and community leaders to understand the guidance that the Department of Education is putting out on how to safely reopen schools and all of the various components that really should be in place to ensure the health and safety, but also the social and emotional well-being of our students as they get ready to either go back in the fall or those that were able to return to in-person in the fall, in the spring. One of the things that I would like to underscore is that from the perspective of the department, we really understand the importance of parents and parents feeling comfortable and confident to return their kids back to the building and school. As a parent of 2 kids with my youngest son, my 6-year-old has special health care needs, there's been a lot of concern from parents such as myself around how safe is it to return back to school. So we have these 2 resources here that if you are interested in looking at into the guidance that we are providing as the department, these are great resources. They are also in Spanish. So if you would like a copy in Spanish, we're happy to provide that. And we really wanted to take a moment to create a place and space for parents to ask questions on what does returning to school look like for summer, whether it's summer enrichment, or what does it look like going back in the fall? And we wanted to be able to not only answer the questions and create a space from the Department of Education, but also having our colleagues from the CDC with us who are really working in close partnership, not only over the last few months, but also in the weeks to come as we look at the beginning of the new school year. So with that, I'd like to actually turn it over to our colleagues at the CDC to start digging deeper into the various components from vaccination to camp guidance to help parents understand the mitigation strategies that are in place to make sure we're keeping kids safe, families safe, and communities safe. Thank you.
Hello, everybody. I am Adam Bjork from the CDC, and thank you very much for this opportunity to be here to talk with you about COVID-19 vaccination of adolescents. And thank you for taking the time out of your day or night to attend this webinar. Next slide, please. All right. A national target has been set for July 4th for 70% of the US population age 18 and up to have received at least 1 dose of COVID-19 vaccine. We are already seeing business sectors come back online at a large scale, and the travel season has now kicked off in full force. Despite all this return to normal, large portions of the population still remain to be vaccinated. It's critical to build on local successes to increase access to vaccine. Continued progress toward this goal and beyond requires building on the tremendous success we have had to date providing access to vaccine to so many. Moving forward, it is important to focus on the following. We need to focus on continuing to expand access to communities. We want jurisdictions to be looking for pockets that still have opportunities for vaccination and to accelerate plans to provide trusted access to vaccine in these remaining communities and settings. We also want to be sure we are reaching what we call the movable middle. We want to identify trusted messengers and community partners to support continued vaccination. And we want to emphasize key messages about the benefit of vaccination. For example, emphasizing messages like everyone should get vaccinated. It is important to get vaccinated, even if you have had COVID-19. And we want to emphasize the importance of getting vaccinated if you are traveling. That means traveling abroad, as well as things like using public transportation locally. Next slide, please. On May 12 of this year, in a 14-0 vote with 1 recusal, CDC's Advisory Committee on Immunization Practices, or the ACIP, voted that the Pfizer-BioNTech COVID-19 vaccine is recommended for persons 12 to 15 years of age in the US population under the FDA's emergency use authorization. In the direct clinical assessment, vaccine efficacy was 100% in preventing symptomatic laboratory confirmed COVID-19 in adolescents aged 12 to 15 years without evidence of previous SARS-CoV-2 infection. Next slide, please. So with that news involving adolescent vaccination, this slide summarizes the stepwise approach we're following to increase vaccine access for adolescents. First, the bottom step of this figure on the bottom of the slide is the leveraging and augmenting of the existing infrastructure for COVID-19 vaccination. This means current COVID-19 vaccination providers updating their systems to allow booking of appointments for children aged 12 to 15 years. Another focus here is increasing the number of currently enrolled COVID-19 vaccine providers who have the Pfizer-BioNTech COVID-19 vaccine on the shelf and who are ready to offer vaccination to children 12 and older. This also means encouraging clinics that maintain a stock of multiple vaccine products to prioritize their stock of Pfizer vaccine for adolescents. And lastly, this means encouraging vaccination of parents and caregivers at the same time that adolescents are administered COVID-19 vaccine. Next in this stepwise approach is to add providers who can reach adolescents in a phased approach. Providers that currently serve adolescents are critical. They are trusted within the community. They can notify, schedule, and vaccinate their patients, including managing routine immunizations. This means this approach also includes expanding to include smaller provider sites needed to increase access, especially among areas of high social vulnerability. And it means adding additional providers based on their ability to reach patients, as well as their throughput capacity. And finally, we have a school-focused strategies that will be critical to reaching adolescents. Schools have been important partners in providing information to parents and families throughout the pandemic. Many schools also have experience with hosting school-located vaccination clinics for influenza and other routine vaccination. School-located vaccination clinics for COVID-19 vaccination will also be important to reaching children and families. Jurisdictions have already started planning with local school districts, with some conducting clinics as early as May and others planning clinics throughout the summer. Next slide, please. This is just a little more information about how we plan to use different channels to reach adolescents. Primary care providers and other providers that currently serve adolescents are key to reaching adolescents, as they are trusted providers and have existing relationships with adolescents and their families. They also have experience with routine vaccinations. I also want to point out that routine childhood vaccinations have fallen critically behind schedule during this past year, and this effort is an opportunity to play catch up a little bit as well. There is an existing network of pharmacies and federally qualified health centers called FQHCs located in communities that have been administering COVID vaccine and Pfizer vaccine in particular for many months and are also known and trusted in these communities. This emphasizes that we are not starting at zero and can jumpstart parts of this rollout for adolescents. And as mentioned in the previous slide, a school-based strategy can expand the reach to adolescents as they return back to school. Next slide, please. Now this graph here on the left shows COVID-19 vaccination coverage by age group. And then the text on the right shows, as of June 21st, yesterday, over 53% of Americans have received at least one dose of vaccine. Data for adolescents aged 12 to 15 years is shown in the dashed yellow line on the chart. Already over 4.3 million adolescents have received at least one dose of vaccine. Next slide, please. All right. CDC has done a tremendous amount of work on operationalizing a framework to help build confidence in the COVID-19 vaccines. The strategy focuses on building trust, empowering healthcare workers, and engaging communities and individuals. CDC has recently developed a version of this strategy specifically for adolescents between the ages of 12 and 18 and their families, as summarized on this slide. This uses CDC's framework for building vaccine confidence, but it adjusts the focus to include adolescents, their families, as well as the communities they live in and the schools they attend. Some of the additional work that will support the adolescent rollout includes collecting data on vaccine confidence through the National Immunization Survey, the NIS Teens version of the National Immunization Survey, and from parents of teens between 12 and 17. Also, a rapid state of vaccine confidence report was created and released last week in response to the ACIP recommendation of COVID-19 vaccine for adolescents and the initial adolescent vaccine rollout. The report triangulates and synthesizes numerous streams of qualitative and quantitative data and organizes results by first, perceptions, concerns, and threats to vaccine confidence, and current content gaps and information voids, and finally, by pervasive misinformation and disinformation. And that rapid state of vaccine confidence report is available on the CDC website. Next slide, please. And that is all for me. Thank you very much again for allowing me to speak with you.
Good evening. My name is Stephanie Erskine, and I will be talking to you today about CDC's Community-Based Organization Toolkit. Next slide. So during today's presentation, I will talk to you specifically about the Community-Based Organization Toolkit, but I did want to give you some background about CDC's communication work. In case you're not familiar with the work that we do, a lot of CDC's power comes from its communication team. We engage in many different activities, including research and evaluation, crisis and emergency risk communication. We do outreach to populations disproportionately affected by COVID-19, professional education and engagement, vaccine safety and effectiveness messaging. We respond to public inquiries, and we also support many CDC vaccine programs, including the COVID Tracker, the Pharmacy Partnership for Long-Term Care, and the Federal Retail Pharmacy Program. Next slide. So as you just saw, my colleague presented on the Vaccinate with Confidence framework used by CDC, and he focused on the adolescent edition. I am including this slide because it really provides a framework for the community-based toolkit that I'm going to present. So like he mentioned, there are 3 pillars to the Vaccinate with Confidence framework. And again, this is not a communication campaign. Rather, it is the strategy and the approach that we use to communicate with communities about vaccinating confidently for COVID-19. The 3 pillars are to reinforce trust through regularly sharing clear and accurate COVID-19 vaccine information and taking visible actions to build trust in the vaccine, the vaccinator, and the system. Empowering healthcare providers by promoting confidence among healthcare personnel in their decisions to get vaccinated and to recommend vaccination to their patients, regardless of age, and to engage communities and individuals. And we do that by engaging communities in a sustainable, equitable, and inclusive way, using 2-way communication to listen, increase collaboration, and build trust in the COVID-19 vaccine. Next slide. So within all of our communication tools, we intend to imbue lots of messages, our key messages about COVID-19. And they are that you can stop the pandemic, that people ages 12 and older can be vaccinated. We encourage everyone to use reliable sources to get information about COVID-19 and the COVID-19 vaccines. The COVID-19 vaccines are safe and effective. COVID-19 vaccines are free. After the COVID-19 vaccination, you may have some side effects, but those are normal and they are signs that your body is actually building protection against COVID-19. And fully vaccinated people can resume activities once they are fully vaccinated. Next slide. Next slide. So we used our website to communicate to large audiences about COVID-19. Our website is available at cdc.gov. And once you get to our website, if you click on COVID-19, you are led to this web page. We have lots of different pages that are under the COVID-19 banner. But when, in particular, talking about the vaccines, we have a tab that is titled Vaccines. The information on these pages is available in English, Spanish, Simplified Chinese, Vietnamese, and Korean. And to access those different languages, we have a tab up at the top. I don't think you can see my cursor, but it's at the top of the page to the right. There's a pull down menu with languages, and you select the language that you would like to see the material available in. And in addition, some of these materials are available in additional languages outside of the ones that I mentioned. Next slide. I want to highlight one page on our website. It's the Vaccines.gov page. And on this page, we have the vaccine finder, and it's a section that you are able to type in your zip code, and you're able to, it helps people to find the latest information about COVID-19 vaccines and their availability in their area. And you're able to find vaccines as they are reported by vaccine providers. Next slide. So finally, getting to the toolkit that you are waiting to hear about. So to help communities to talk confidently, speak confidently about COVID-19 vaccine, we developed a toolkit that includes resources to help communicate information on COVID-19 vaccines. And those toolkits that we offer are parsed into different audiences or based on different settings. Tonight's I will be focusing on the community-based organization vaccine toolkit. And part of the reason is because the target audience for the community-based organization toolkit is very broad, and I think is applicable to just about any group of concerned people and citizens. The next slide, please. So the community-based organization toolkit is intended to educate communities on the importance of COVID-19 vaccine. And as was mentioned before, is designed for staff and personnel of organizations serving communities affected by COVID-19. And that includes a large array of different types of groups, including social service organizations, meal delivery services, fraternities and sororities, youth organizations, senior centers, PTOs, PTAs, any group of people that are interested, they fall into this category, and we have this toolkit available for you. Next slide. I just want to highlight some of the materials that are included in the toolkit. And I also want to underscore that all the materials that I will mention are available for free on our cdc.gov website. And all of those materials are downloadable for you to use. So a couple of the contents of the community-based organization toolkit include a presentation and key messages and FAQs. And again, these materials are available in English and in Spanish. Next slide, please. We have printable materials, and the reason that these are called out is because the graphics are enhanced so that once you print them out, they come out and looking nice and polished. But we have materials and graphics. Again, these are available in different languages that are listed on the screen, and they can be printed out in black and white, and they still look very nice. We want to make sure that they are attractive, regardless if you have a color or a black and white printer. Next slide. We also have printable assets, including posters, stickers, infographics, and photonovellas. And again, the photonovellas are available in different languages. The posters are available for color print as well as black and white. And the stickers, in order to print the stickers, you just need to put a sticky, I'm losing the term, but a page that has a sticky backing, and then you can print those stickers out and give them out as a way to encourage individuals to share their vaccination news, as well as to encourage others to confidently get vaccinated for COVID-19. Next slide. Within the toolkit, we also included some documents that you can customize specifically for your organization and or your audience. That includes the introductory letter, a letter to members, and we have a material that you can drop into a newsletter or a blog, depending on any type of communication that you use to talk to your community. In order to customize these documents, you just need to copy them and put them into maybe a Word document. And then you can customize it with your logo, with any specific language that you want to include. And then you can put that wherever you want to print it. You can print it or you can post it into a website. Next slide. We also have created some drop and use social media assets. We have the images that you see that are available both in portrait style, which include individual faces, as well as all text style that does not include actual faces, but has graphics and text. Those social media posts are available in English and Spanish, and we also have language that can accompany these images. You don't have to use both of them together, but it's up to you. You can use just the images, you can use just the text, but we have that ready for you, and it's all using the same language that we use throughout the rest of the kit that promote those key messages. Next slide. My colleague talked a lot about vaccines for adolescents, but within that community-based organization toolkit, we have FAQs and information for parents, as well as pediatric healthcare providers and professionals. And we have documents that are there for them. In addition, we have some printable materials specifically for parents and healthcare providers that treat adolescents. Next slide, please. And this is not included necessarily within the toolkit, but we have some documents available on the same website that are available if you're interested in promoting or setting up a COVID-19 vaccine clinic in your community. So this just gives you the rationale and helps to walk you through the reasons why you might want to do that and what you can do to get that started in your community. Next slide. In addition to the toolkit I just went over, we have other materials available in our Communications Resource Center that includes links to additional toolkits for additional audiences. We have additional print resources. We have web widgets, which are just little badges that you can put on a website. And if someone clicks on that widget, they're taken directly to a web page where they will find information about COVID-19 vaccines. We also have a social media page that has lots more social media graphics if you want to use some of the ones that we have on that site, as well as videos and many more other resources that you can use to supplement the materials in the toolkit, and also just for your information and education. Next slide, please. And finally, I just wanted to call out some of the websites that I mentioned during this presentation. You will have access to this slide presentation after we're done. And if you want to just copy these web links from that presentation, you are more than welcome to, and it will take you directly to the different resources that I mentioned. And with that, I will wrap up my presentation, but I thank you so much for your time and attention and look forward to your questions afterwards. Thank you.
Hi, everyone. I'm Chandra Slava, and I am lead for the community guidance team within the COVID-19 response at CDC. And it's my privilege today to share our updates on guidance for youth camps. Next slide, please. So first, camp should plan and prepare for this camp season, which might look still a little different than prior years. Next slide. Camp operators should involve staff, parents and guardians, and other community partners to develop a plan to protect staff, campers, families, and communities from the spread of COVID-19. Next slide. This plan should include the following, among others listed in the guidance. 1, strongly encourage COVID-19 vaccination for all eligible campers, staff, and families. 2, document protocol differences, if any, for people who are fully vaccinated versus those who are not fully vaccinated. 3, the application of multiple prevention strategies to protect people who are not fully vaccinated. 4, reviewing safety protocol for staff and campers who are at increased risk of getting severely ill from COVID-19. Modifying camp activities to choose safer activities, such as outdoor over indoor activities, and planning for an outbreak. Next slide. Next slide, please. Camps can help increase vaccine uptake among campers, their families, and staff. Next slide. CDC recommends that everyone ages 12 and older get fully vaccinated against COVID-19. To promote vaccination, camps can educate camp families about COVID-19 vaccines, share Vaccines.gov links to staff, campers, and their families so that they can get vaccinated in their community. And 3, lastly, offer flexible, supportive leave options for staff to get vaccinated and to those who may experience side effects after vaccination. Next slide. CDC's updated guidance for operating youth camps includes sections of guidance based on whether everyone at the camp is fully vaccinated or not. Let's start by discussing the guidance for where everyone is fully vaccinated, including campers and staff. Please note that some campers or staff might not be able to get the COVID-19 vaccine due to medical or other conditions and should be considered by camps for exemptions to COVID-19 vaccine requirements. Next slide. Staff and campers who are fully vaccinated do not need to wear masks at camp, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidance. Although fully vaccinated persons do not need to wear masks, camp should be supportive of staff or campers who choose to continue to wear a mask. Physical distancing is not necessary for campers and staff who are fully vaccinated, except as indicated in CDC's interim public health recommendations for fully vaccinated people. There is a link to that, which will be available later. Camp should continue to facilitate health promoting behaviors such as hand hygiene and respiratory etiquette to reduce the spread of infectious disease in general. Camp should also continue to follow cleaning, disinfecting, and ventilation recommendations, including routine cleaning of high-touch surfaces and shared objects. They should also maintain improved ventilation, including opening windows, using air filters, and turning on fans. Next slide. People who are fully vaccinated do not need to undergo routine COVID-19 screening testing. If a camp experiences an outbreak of COVID-19 among people who are fully vaccinated, camp administrators should promptly contact their state or local health department and work with them to isolate people with COVID-19-like symptoms. Ensure that people with COVID-19 symptoms get tested and quarantine any unvaccinated close contacts of people with symptoms. Camp administrators should also notify the appropriate family members of all campers. People who are fully vaccinated with no COVID-19-like symptoms do not need to quarantine or be restricted from camp following an exposure to someone with suspected or confirmed COVID-19, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including that of a local business or workplace. Next slide. Now, we can talk about the guidance for camps where not everyone is fully vaccinated. This is including camps serving children under the age of 12. Next slide. Mask use indoors is strongly encouraged for people who are not fully vaccinated, including children. Given evidence of limited transmission of COVID-19 outdoors, CDC has updated our guidance for outdoor mask use among people who are not fully vaccinated. In general, people do not need to wear masks when outdoors. However, particularly in areas of substantial to high transmission, people who are not fully vaccinated are encouraged to wear a mask in crowded outdoor settings or during activities that involve sustained close contact with other people who are not fully vaccinated. Although people who are fully vaccinated do not need to wear masks, camp programs should be supportive of campers or staff who choose to wear a mask. Camps may also choose to continue to require masks for vaccinated and not fully vaccinated campers and staff. For example, in order to adhere to prevention strategies when it is difficult to tell who has been vaccinated, or to set an example for not fully vaccinated campers. Masks should not be worn by children under the age of 2 years old. a person with a disability who cannot wear a mask, a person for whom wearing a mask would create a risk to workplace health or safety when sleeping or when doing outdoor activities that could get masks wet. Additionally, heat-related illness is a long-standing health concern. Many camps have heat policies in place to ensure that staff and campers do not experience heat-related illness. And if they do, camp staff know how to properly respond. Next slide. Cohorts, or pods, are small groups of campers and staff who stay together throughout the day to minimize exposure to other people while at camp. Cohorts should have the same staff, stay with the same group of campers, and remain together as much as possible for the duration of camp. Campers and staff in the same cohort who are not fully vaccinated should continue to wear masks at all times, except in the situations noted previously. When everyone at camp is fully vaccinated, physical distancing is not necessary. For day camps, where not everyone at camp is fully vaccinated, physical distancing includes at least 3 feet should be maintained between all campers within a cohort. If cohort members are eating or drinking without a mask indoors, they should be at least 6 feet apart. At least 6 feet between all campers outside of the cohort, at least 6 feet between campers and staff, and at least 6 feet between staff. Next slide. Now I'll go over overnight camps where not everyone is fully vaccinated because they have a few additional things to consider. Next slide. CDC recommends everyone 12 years and older should go get a COVID-19 vaccine to help protect against COVID-19. People are considered fully vaccinated 2 weeks after that last dose. Thus, individuals eligible for vaccine should get vaccinated and receive their last dose at least 2 weeks before camp start date. Camp administrators should request that campers, their families, and camp staff follow guidance for travelers before camp arrival to reduce exposure to COVID-19. Next slide. Upon arrival at camp, campers should be assigned to cohorts that will remain together for the entire camp session without mixing with other campers and staff in close contact circumstances to the largest extent possible. For this guidance, a household cohort means campers and staff who are staying together in a cabin, bunkhouse, or a similar defined space. Household cohort members do not need to wear masks or physically distance when they are together without non-household cohort members nearby. When different household cohorts are using shared indoor or outdoor spaces together during the day or night, continue to monitor and enforce mask use, physical distancing, and healthy hygiene behaviors for everyone, unless fully vaccinated campers and staff do not need to mask or distance per camp policy. If physical distancing can be maintained while outdoors, masks can be removed. Staff should ventilate and clean bathrooms regularly. For example, in the morning and evening after times of heavy use. And if needed, disinfect using an EPA-registered disinfectant. When camp staff who are not fully vaccinated are away from camp, for example, during days off, they should choose safer activities and follow all prevention measures, masking and distance, for example. Consider having any not fully vaccinated staff do a screening test when returning after time spent away from camp. Camp administrators should also request that campers, their families, and camp staff follow the guidance for domestic travel during COVID-19, following travel from camp. Next slide. Camp should isolate staff or campers with symptoms immediately and refer them for testing. They should remain isolated at camp or at home until the test result is returned, and medical care should be provided as needed. Camp operators should notify all parents and guardians and the health department immediately following a positive result for COVID-19, and work with local public health officials to identify close contacts, as well as quarantine, testing, and isolation recommendations or requirements. Regardless of vaccination status, campers and staff should monitor for symptoms of COVID-19 for 14 days following exposure. I believe that concludes my updates. Go to the next slide. Yeah. Next slide, just in case. There we go. Okay. I did have a couple, my apologies. So here are links to the various resources that were mentioned to support camps as well as families who are considering camps this summer. There's many general resources and also more specific resources for specific populations or people who might need to take extra precautions. And there's yet another slide with more resources. The next slide, please. Yes. So we'll have some additional guidance that might be applicable in a camp setting, and our guidance for school settings, and for those who might be direct service providers, parents, caregivers, and guardians, or people with development and behavioral disorders. These other resources can be helpful in determining your best policies and practices for keeping up summer camp opportunities for you. Thank you for the opportunity to share this today, and look forward to your questions.
I believe this is the time, and I don't know, Carolyn, if you were going to moderate the questions, that we can just jump into the questions. One of the questions, and I'll start off from the Department of Education side, is regarding what school will look like in the fall. And that is a really great question. And one of the things I want to underscore is, from the federal government side, or from the U.S. Department of Education, we are providing guidance to schools and districts and states as to how to reopen schools and ensure that reopening is happening safely. However, the specifics of what school will look like, meaning will 5 days a week in person be offered, that is really a local decision. And so it's going to be really important that you contact your school, you contact your principal or superintendent or the district office to get clear details on the reopening plan. I can share with you that every district across the United States is in the process of not only thinking about summer supports for students, but also getting really clear on planning for what schools will look like in the fall. We have heard from many school principals and school leaders that are reopening that they are actually planning parent tours, and parent tours that will allow parents an opportunity to come into the school and visually see the changes that schools are making to accommodate safe in-person learning. And so I would really encourage you to, wherever you live, to take a moment and call your school, call the principal, to get that clarity as to what school will look like in your area. Another thing that I'd like to mention that the department is working on is a return to school roadmap, which we are hoping to launch mid-July, which will help pull all these resources together that we have provided or created over the last few months on how to safely reopen schools, to make sure that parents have an understanding of things that they should be looking for as their kids are getting ready to return to school. Also supports for teachers, for principals, for superintendents, so that they can continue to plan accordingly on the reopening of schools. And we are making sure that the guidance that we have is current and up to date with the CDC guidance as well. So we're working very closely with our CDC friends. And with that, I know there were a lot of questions for our CDC counterparts, so I wanted to turn it over to them. And maybe we can start with some of the questions around the under 12 population.
Yes, hi, this is Laurie Hicks speaking. And thank you for having us on the webinar tonight. I really appreciate the opportunity to interact with all of you. I've been hearing a lot of questions about when is my son or daughter going to be eligible for vaccination. I have a 9-year-old son, and so I'm very interested in the timeline for getting him vaccinated. So right now, the manufacturers are working on dosing studies to identify optimal doses for the kids under the age of 12. So right now, I'm not anticipating that we will have vaccine recommendations for kids under 12 in the next couple of months, but I'm hopeful that we'll have recommendations either later this year or early in 2022.
Hi, everyone. This is Chandresh, and I'd actually like to follow up with a question that was sent ahead of time to us regarding the WHO's statement on not recommending vaccines for children. And I think I want to provide a little more detail and context to that in hopes of getting ahead of some other questions that might follow as a result of reading that press release. The intent of it is really is more of a resource allocation perspective. And so we think in the United States that we have an abundance of vaccine, and we're doing a pretty good job of reaching our adult population vaccination targets. And so in this, I suppose in this moment of privilege, in the space of privilege, we can, and as we know that the vaccine is very effective in child populations, at least over 12, and we're evaluating those efficacy numbers in younger populations moving ahead, that we would like to continue to vaccinate children to protect them as well, because they are populations where transmission occurs. And even if they might have less severe disease, there's still the presentation of severe disease on occasion. And they're effective ways of transmitting amongst the community. Just having nieces and nephews myself, I know we get very close and there's a lot of mixing around. And, you know, in light of that, if we can find and leverage one of the best tools we have to prevent the spread of COVID-19, I think that will still be an important strategy for us to continue in the United States. And the hope is that as we, as a country, support other countries in boosting their vaccine supplies, that they too will be able to enjoy a larger vaccinated population. Thank you.
Thank you so much. I would just like to remind our attendees that if you have a question, please go to the Q&A icon at the bottom of your screen to pose your question.
And this is Lori. I was just going to jump in on, there's a question related to vaccine safety. The question's related to a 13-year-old who had a seizure 24 hours after their second vaccine. Is that something of concern with teens getting the Pfizer vaccine? And I think that's a really important question, and one that we are tracking very closely. In fact, I think maybe one of the misperceptions I've had when I've had conversations with my friends and family members about this is that there is a concern that perhaps the vaccines don't have the same kind of level of safety monitoring as other vaccines have in the past. And in fact, it's actually quite the opposite. These vaccines are being tracked much more closely from a safety perspective than any other vaccine in history. So I think it's really helpful to have that context. So anytime there is a safety issue, we are requiring that healthcare providers report those directly to our, there's a couple of different safety monitoring systems, but one is our VAERS system, which allows actually parents or individuals or healthcare providers to report directly to CDC and FDA any concerns related to the vaccine. What I would say is that, you know, we are carefully monitoring every safety report. We are looking into any safety reports that we receive, and if there are any concerns that would warrant any changes in policy related to vaccine, we are definitely, you know, going to consult with we have an organization that provides input on vaccine recommendations to us, and so I will hand it over to Chandra to take over the next question.
Thank you. So we received a question regarding concerns from family whose children are too young for vaccination, as well as those who have children with intellectual or developmental disabilities or otherwise immunocompromised, and worry about them being able to return to a safe environment at school. And we appreciate these concerns and are encouraged by this last year and the efforts that schools and other settings have done to implement layered prevention strategies. Perhaps in isolation, any one is not 100% effective, but in a school setting in particular, what we've seen in a number of our evaluation studies is the use of masks, the presence of physical distancing where possible, enhanced cleaning and disinfection, improved ventilation in schools, have all tremendously reduced the risk of transmission in a school setting. And so for those children that will perhaps remain vulnerable, or maybe not vulnerable, but more susceptible to severe disease by a potential infection from COVID-19, we have ways in which to ensure a safe space for them to attend school, to be in school, and return to the normal services that they had enjoyed before this pandemic began. So when we think of the under 12 population to still be unvaccinated, wearing a mask and physical distancing will still remain effective ways to keep them safe and to reduce transmission in the communities. We can do our part for those of us that have the opportunity and the opportunity to become vaccinated and become fully vaccinated, to encourage and support the environments that these children are in to make sure that they stay safe. I hope that's enough to answer your question. Thank you.
Great, thank you so much. Just looking through the questions to see if there's anything that has not been answered yet. Not seeing anything else. Are any of the panelists, do you have any closing remarks or anything else you'd like to add to the conversation before we wrap up?
I did just
Sure,
catch
I will. Oh, I'm sorry. Go ahead.
I did just catch one question that came in that I can respond to. It's, will the CDC be recommending masks for individuals who are fully vaccinated in schools in the fall? And the answer to that is no. If someone is fully vaccinated, it's not a requirement to continue to wear a mask. However, since certain staff and faculty may be and have engagements with children or might want to model good behavior, but while not necessary to protect the adult who might be vaccinated, it's good to provide that supportive environment for children. So if there are localities or other laws and regulations at various levels that encourage the use of masks in schools, then there's not a recommendation against it. It could lend to be a supportive environment for children who might need to continue to wear masks while they remain unvaccinated.
Hi, this is Adam Bjork. We had a couple of questions that asking about the same topic, and I'll read one of them. Will 12 to 15-year-olds be able to consent to their own vaccines, or do they need a parent's permission to get it? And the answer to that is that the rules, the laws for parental consent for vaccination vary from state to state. So one answer does not apply to every state. And so that will depend on the local regular laws. Thanks.
And on the ed side, I think the last thing that I would add is we are closely monitoring as things change, as the guidance changes, and we are making sure that we're staying in close contact with education leaders, with organizations who serve teachers, principals, parents, students, to make sure that we're communicating the most recent, up-to-date guidance. And so all the while, I think it was Adam, you mentioned just the timeline. We are watching this closely, and we are also working with state leaders to make sure that the best information is coming out as soon as we have it. And so I would encourage all of you, so many of these types of policies and decisions happen at the local level. So if you have really specific questions as to what's happening within your area, to contact either your local principal, and on the CDC side, I'm not sure who the best contact locally would be, or if there's a place specifically on your website that can drive people for more local details if they're in need of that information.
Well, thank you very much, Dr. Samuel. In the interest of time, we are right up into the end of our time today. So I would like to first take this opportunity to thank all of our panelists who joined us this evening to share this critically important information. I'd also like to take this opportunity to thank all of you, the attendees who joined us this evening, and for posing your wonderful questions and very useful information that was shared. I'd like to thank Carmen Sanchez from the U.S. Department of Education, and I'd like to thank the cpir team for their work in pulling together this webinar. We appreciate all of you joining us, taking the time to join us this evening. I appreciate all the information that was shared. This webinar was recorded and will be posted to the cpir website within the next 24 hours. You can find it at the parentcenterhub.org, and you can find additional information about school reopenings, as well as information from the CDC. So as we close out the webinar, thank you all for your time. And there will be, as you leave the webinar, there will be a survey. Please take a few moments to complete the survey. We very much appreciate your feedback and look forward to bringing more information to you as it develops. So thank you again, everyone, for joining us today, and have a wonderful evening. And that concludes our webinar.